Others have passed on during childbirth. Those who have been successful, majority are living positively, and sometimes because they are living positive, I mean with the HIV, they are afraid, so they have left these younger kids who are positive to the elderly women.
The causes of teenage pregnancies are many, but one of the key issues that seems to be coming out, which we've heard from the children and also from other stakeholders, is poverty. Poverty is a big issue because children need basic services, girls need pads, and because they can't get them, they are tempted to sleep with men who are able to provide for these small services. The other issue which is very important is the cultural practices and also how we bring up our children, the parenting. We do not talk about issues of sexuality. We do not empower these children to understand when they are right to how to understand their bodies, how to understand their needs, but also how to get services, to get help when they need it. So these issues are very important in ensuring that children continue to, they're important to ensure that children are able to access health services.
A girl and a boy as far as adolescence is concerned, but still it is still not enough. So we are calling upon a multi-sectoral collaboration, especially Minister of Health, to allow these adolescents learn how to make use of healthy facilities. For instance, their behavior as far as sexually productive care is concerned. Majority are afraid, majority are scared. They want to seek these healthy seeking behaviors in a hidden in a hidden manner, which is not proper sometimes. And then we're also looking at poverty, polygamous, alcoholism, so many other factors. The whole issue lies about poor parenting, especially in Busoga, that parents have ignored their roles as a woman, as a man. Sometimes you find a man managing the home, sometimes you find a woman managing the home individually without a partner. So it has made a problem.
I'm happy to report that because of the work of SHARE and also other stakeholders in Buyende and Adjumani, we've been able to bring down the rates of teenage pregnancies. We've seen Adjumani, I think last year we were able to bring them to about 13-14%. Buyende is still at 24%. That means there's a lot of work to be done. And the national average of teenage pregnancies in Uganda is 24%. So at least we've been able to bring it to the national average. There is still more work. 24% is a high. So we need to continue to work to ensure that we are bringing down the number of children that are getting pregnant every year.
Today now, cultural institutions standing up to, call out for people to embrace re-entry for these teenage mothers. We have an article on that, it's online, where we have the Madi Cultural Institution asking parents and stakeholders to support re-entry. And this is as a result of our back-to-back engagements on the SHARE program that FAWE Uganda as an organization interested itself in it to understand why, the high dropouts. So that research was conducted by our executive director, Ms. Susan Opok-Tumsime, that she did while she was on her Echidna scholarship in the Brookings University. And that earned us a grant that today we are using to popularize the re-entry guidelines in Adjumani, because her research findings indicated that today the girls are out of school because of teenage pregnancy and as a result of ignorance.
SHARE project has been implemented in 2 districts, in Buyende and also in Adjumani, and we are seeing that from our work we've seen a lot of positive changes, especially in terms of empowering young boys and young girls to be able to access sexual reproductive health services, and we've also seen that we have been able to strengthen different health systems to ensure that they're able to provide sexual reproductive health services to young people.